Today's topic is, hello students, today's topic is the blood supply of heart. Why this blood supply of heart is important? You know the coronary artery disease is the silent killer disease and it is the most common disease in the affluent societies, in the developed countries and now also in the developing countries. So, the students, medical students must be familiar with the anatomy of the blood supply of heart. So, to know the coronary heart disease, the anatomy of heart and the blood supply is important. In this, after seeing the blood supply of heart, we will see the radiological investigations of the coronary artery disease and also the some of the treatment modalities in the applied aspects. That is the way we are going to proceed with this topic. So, we will now see the anatomy of the blood supply of heart. The blood supply of heart we have to see under the two headings, arterial supply of heart and the venous drainage of heart. We have to see, as I told, under the main headings, arterial supply of heart and the venous drainage of heart. First, we will see the arterial supply of heart. You all know the heart is filled with the heart chambers are filled with the blood. This blood nourishes the inner 75 to 100 micrometer of the endothelial surface. Except this, the heart is supplied mostly by the two coronary arteries, right and left. What is this coronary artery? This coronary artery is a vasa vasorum of the ascending aorta. I think you will be all knowing what is vasa vasorum. Vasa vasorum is the artery which supplies the layers of the vessel wall. So, this coronary artery is the vasa vasorum of ascending aorta because the heart is developed from the fusion of two primitive endothelial tubes which represent the ventral aorta. Anatomically, the coronary arteries are not end arteries. As we know, the coronary arteries anastomose with each other by their trunks, by their branches and by their sub branches at all the levels, at all the layers of the heart. But if you see, functionally they behave like end arteries. Why the coronary arteries are called as coronary arteries? Because they form an inverted oblique crown. As we see in this picture, this is the how the anastomosis of the coronary arteries and the branches marginal, interventricular, they form the shape inverted oblique crown. In this, if you see, the base is formed by the anastomosis of base of the crown is formed by the anastomosis of the coronary arteries and these are the interventricular branches and on the sides are the marginal branches, they meet at the apex. Roughly it is like the inverted oblique crown. So, they are called as coronary arteries. The coronary arteries, we know the heart is made of three layers, endocardium, myocardium and epicardium. Where these coronary arteries are situated? They are usually subepicardial, but occasionally in the major grooves they are hidden by overlapping myocardium or embedded in it and this will be called as myocardial bridges. Do you know what is the diameter of coronary arteries? The diameter of coronary arteries ranges from 1.5 and 5.5 millimeter if you take the diameter at their origins. You know this diameter goes on increasing up to the 30th year of life. If we compare the left coronary artery and the right coronary artery, the left exceed the right in 60% of hearts, the right being larger in 17% and both vessels being equal in 23%. So, till now we are seeing the introduction of coronary arteries. In this introduction, we have seen what are coronary arteries. They are the vasa vasorum, and where they are situated. They are usually subepicardial, occasionally hidden by myocardial bridges. Then we saw the diameter of coronary arteries, that is between 1.5 and 5.5 millimeter. In this again we compared the left and right. We saw the left is having the wider caliber than the right. So, as we proceed to the arterial supply or the venous drainage, the student should be familiar with the grooves on the cardiac surface. The major grooves on the cardiac surface are three: coronary sulcus, also called as atrioventricular sulcus, and the second major is anterior interventricular sulcus, and the third will be the posterior interventricular sulcus. So, we should know where these grooves are situated first, then we will proceed to the coronary arteries. This diagram shows the sternocostal surface of the heart. In this we are seeing in this sternocostal surface we are seeing the right atrium, right ventricle, left ventricle and left atrium. In this we see the coronary sulcus, the oblique sulcus. This coronary sulcus is actually a circular sulcus encircling, and it is having anterior part and posterior part. In this we are seeing the anterior part of coronary sulcus in this picture that separates the right atrium and right ventricle. If you see in this, anterior part can be better called as right anterior part of coronary sulcus. Then where is left anterior part of coronary sulcus? It is actually hidden by the pulmonary trunk. So, this left part is minimal than the right part. Then in this surface you are seeing another major sulcus, that is the anterior interventricular sulcus separating the right ventricle and the left ventricle. So, in this surface we saw the right part of anterior atrioventricular sulcus and anterior interventricular sulcus. This picture, as we know, this is the picture of the base of the heart and the diaphragmatic surface of the heart. You all know the base of the heart is made of left atrium mainly and partly by the right atrium. Separating the left atrium and right atrium will be the interatrial groove. Then this is the diaphragmatic surface of the heart, which is formed mainly by the left ventricle and partly by the right ventricle. Separating these two ventricles is the posterior interventricular sulcus. Separating this base and diaphragmatic surface is the posterior part of the coronary sulcus. So, the coronary sulcus, as I told, it has anterior part and posterior part. In the anterior part, right part is major, left part is less. Then two interventricular sulcus we have seen, anterior interventricular and posterior interventricular. So, we have to remember these three sulci before we proceed now with the coronary arteries. The coronary arteries, they take origin from the aortic sinuses. What is aortic sinus? First I have to tell. You all know the aortic opening is guarded by aortic annulus, which has three semilunar cusps. This three semilunar cusp, one is anterior and two posterior cusp. Above each cusp, the ascending aorta presents a dilatation known as aortic sinus of Valsalva. These aortic sinuses give origin to the coronary arteries. The aortic sinuses of Valsalva we are seeing in this picture. In this picture, you are seeing the three cusps of the aortic valve, one anterior and two posterior, and above the anterior you see the opening of right coronary artery. Above the left and posterior you see the opening of left coronary artery. Okay. Now, we will start with the one main coronary artery, right coronary artery. The right coronary artery, now we will see under the following headings: origin, course, terminations, branches. So, these are the way we will proceed with now each artery. Now, I will start with the right coronary artery. Right coronary artery origin from the anterior aortic sinus of ascending aorta. So, this anterior aortic sinus of ascending aorta can be called as right coronary sinus also. The clinicians, they tell right coronary sinus instead of anterior aortic sinus. So, this is the origin of right coronary artery. Now, we will proceed with the course of right coronary artery. Before this, if you see the variation in the origin, you see this ostium, the opening may be in few cases may be below the margin of the cusp in 10%. Okay, now we will proceed with the course. The right coronary artery passes forwards and to the right between the pulmonary trunk and the right auricle. So, in this picture you are seeing this is the pulmonary trunk and this is the right auricle. This is the right coronary artery passing forwards and to the right. Then it runs along the right part of the AV groove and winds round the inferior border of the heart. So, like this we saw the course of right coronary artery. First it passes forwards and to the right between the pulmonary trunk and the right auricle. Then it descends downwards and to the right along the anterior part of the AV groove and it winds around the inferior border of the heart. So, then this after winding around the inferior border of the heart, it reaches the posterior part of the AV groove and reaches the crux of the heart slightly to the left. So, we should know what is the crux of the heart. I think the most of the students will be familiar, but I will tell what is this importance of this crux of the heart is the meeting point of the interatrial, posterior interventricular and posterior part of the coronary sulci. So, this right coronary artery has now terminated near the crux of the heart slightly to the left. How it terminates? It anastomoses with the circumflex artery. So, this is about the course of the right coronary artery running in the anterior part of the AV sulcus, winding round the inferior border of the heart, reaching the posterior part of the AV sulcus, terminating slightly to the left of the crux, anastomosing with the circumflex artery. Now, we will see the branches of right coronary artery. Before that, if it is very interesting, we can also know the variant terminations of the right coronary artery. The right coronary artery may end in the right cardiac border in 10% or between this and the crux in 10% or reaching the entire reaching the left border traversing the entire atrioventricular sulcus in 20%. So, this abnormal terminations may be present in the 40% of the right coronary artery and the normal termination, that is terminating slightly to the left of the crux in 60%. So, still now we saw the origin, course and termination and how much the termination is normal in the population and how much it is abnormal, variations of the termination we saw. So, that is the course and termination. Now, we will see the branches of right coronary artery. Branches of right coronary artery can be how we can classify. For a descriptive purpose, we can classify when it is running in the anterior part of the AV groove, that is from the origin to the inferior border, that will be the first segment. Then from the inferior border to the crux, that will be the second segment. Like this, we can divide the see the branches under the two main categories. If we see the branches of first segment, then we have to divide this. Again we can see the branches under the following headings. It may be the ventricular branches or the atrial branches. Like this, we will see the branches of the right coronary artery. As I told, the right coronary artery branches from first segment, that is up to the inferior border, and branches from the second segment up to the crux of heart. This is only for descriptive purpose we are seeing. Branches from first segment, we will see ventricular branches and atrial branches. Ventricular branches, first we how the students can remember which ventricle, which atria, the running in this groove, it will supply the adjacent atria and adjacent ventricle. So, this is the first segment, it is running in anterior part of AV groove, it will naturally supply right atrium and right ventricle like this. So, the first ventricular branches supplying the right ventricle we will see, then the atrial branches supplying the right atrium we will see in the first segment. Then if it runs in the second part, if it runs in the posterior part of AV sulcus, naturally it will supplies the posterior surface of right atrium and posterior surface of right ventricle. Again in that part we will see again the ventricular branches and atrial branches. So, supplying adjacent chambers, like that we have to remember. So, now we will see with the ventricular branches. The ventricular branches are many. First, if you take the first branch is the right conus artery. Right conus artery supplies the infundibulum of right ventricle. This right conus artery may be called as third coronary artery when if it arises from the anterior aortic sinus, and this is possible in 36% of specimens or cases. And if this right conus artery anastomoses with left conus artery, this anastomotic chain will be called as annulus of Vuissens. So, now we are seeing the branches of first segment of right coronary artery. In this first segment we are seeing the ventricular branches, and the first branch now we have seen is the right conus artery, and this right conus artery anastomosing with the left conus artery will be called as annulus of Vuissens. Now, the other ventricular branches supplying the right ventricle. The other ventricular branches supplying the right ventricle may be 3 to 4 in number, and if you compare the right ventricular branches and the left ventricular branches, some authors opine that this right ventricular branches they arise at right angles, and the left ventricular branches they arise at acute angles, and it is of interesting this angle the branches angle of the branches is very interesting for some authors. So, if you see the number of right anterior ventricular branches, they will be 3 to 4 in number, like this, supplying the sternocostal wall of right ventricle. So, these are the large branches supplying the sternocostal wall of right ventricle. In this, one branch running along the inferior border of the heart is called as right marginal artery. This right marginal artery is the longest ventricular ramus, and it runs along the inferior border of the heart to reach the apex of the heart. So, still now we saw the ventricular branches of first segment of right coronary artery. They are the right conus artery and the right anterior ventricular branches and the right marginal artery. Now, we will see the atrial branches of first segment. Atrial branches of first segment supply the myocardium of right atrium like this, and they will be 2 to 3 in number. In this branches supplying the right atrium, the anterior surface of right atrium, the important branch we have to see is the sinuatrial nodal artery. That is the artery which supplies the sinoatrial node. You all know the sinoatrial node is situated in the right atrium. So, this naturally this right atrial branches in the anterior part should supply the right atrium. So, that one important branch we will see the sinuatrial nodal artery, which will be arising from right coronary artery in 65%. Then remaining percent it may arise from the left coronary artery. So, what is this course of this right sinuatrial nodal artery? We will see now. Sinuatrial nodal artery passes back to the right in the groove between the right auricle and the root of the ascending aorta like this, and then it branches around the base of the superior vena cava. Like this, it branches around the base of superior vena cava to reach the center of sinuatrial node and supplies the sinuatrial node. So, this is the course of sinuatrial nodal artery. Up to this, we saw the atrial branches and ventricular branches of first segment of right coronary artery. Then we have to see the branches from the second segment. As I already told, this branches from second segment will also supply right atrium and right ventricle, but posterior surface and diaphragmatic surface. Right posterior ventricular rami 2 in number and right posterior atrial rami usually single, they supply the posterior surface of right atrium. When this right coronary artery is running in the posterior part of the AV groove, when it approaches the crux, it gives one important branch, that is the posterior interventricular branch. Not only it is the number will be not the 1, it may be 1 to 3 given by the right coronary artery. Even though 1 to 3 will be given by right coronary artery, at sometimes none may be present, that is the posterior interventricular branch. This posterior interventricular branch runs in the posterior interventricular sulcus and it is accompanied by great cardiac vein. If they are more than one artery will be in the middle of the sulcus and the other arteries will be in the and this one artery will be flanked by the other arteries. That is the situation of posterior interventricular artery. Posterior interventricular artery runs in the posterior interventricular sulcus accompanied by middle cardiac vein. So, what is this posterior interventricular branch supplies? It supplies the diaphragmatic surface of both ventricles. If I tell the diaphragmatic surface of both ventricles, mainly as a whole diaphragmatic surface of right ventricle, only a part of left ventricle adjoining the posterior interventricular groove is supplied by posterior interventricular branch. Among this, important is the septal rami. Septal rami supply the postero-inferior 1/3 of the ventricular septum. So, this finishes the branches of the right coronary artery. The branches of right coronary artery from the first segment and from the second segment we saw. From the first segment we saw the ventricular branches, right conus artery and the ventricular anterior ventricular branches 3 to 4 in number, and the largest of the ventricular branches will be the right marginal artery and the atrial branches supplying the right atrium. In this atrial branches supplying the right atrium, we saw the important artery sinuatrial nodal artery. Sinuatrial nodal artery typically courses backwards and to the right in the groove between the right auricle and the root of the ascending aorta. Then it branches around the base of the superior vena cava to enter the center of sinuatrial nodal artery. Then branches from the second segment, we saw the branches from the second segment gives the 1 to 2 in number supplying the posterior surface of right atrium and right ventricles. And in this, as if continuity of the right coronary artery, we saw the posterior interventricular branch that supplies the diaphragmatic surface of both ventricles and septal rami which supplies the postero-inferior 1/3 of the septum. So, till now we saw the branches of the right coronary artery. Now, we have to see the importance of this posterior interventricular branch. Then, what is the importance of posterior interventricular branch? You would have heard this cardiac dominance. This cardiac dominance is determined by the posterior interventricular branch only. If this posterior interventricular branch arises from right coronary artery, then that is right cardiac dominance. If the posterior interventricular branch arises from left coronary artery, then that is left cardiac dominance. And in some individuals, this posterior interventricular arteries may be more than one, and it may arise from right or left, and that category will be called as balanced type. So, that is the importance of posterior interventricular branch. If you ask me, then what is the importance of this right left cardiac dominance, which is good, which is not good for the patients or for the persons? If you ask, the right cardiac dominance is the good for the persons, because if left cardiac dominance, then the posterior interventricular artery will be given by the left coronary artery. You think already the left coronary artery will be supplying the major part, and if this overburden of the supplying the diaphragmatic surface of right and left ventricle is taken over by left ventricular artery, then imagine that left coronary artery is blocked, then that person is going to suffer from severe coronary disease. So, that is left coronary left cardiac dominance is not so good, and the balanced type are the fortunate persons, they suffer from the less coronary artery disease. So, we will now see the cardiac dominance. Before that, we will complete this. AV nodal artery is also the septal branch of the posterior septal ramus of posterior interventricular branch supplying the AV node, and it may arise from left circumflex artery. So, as I already explained, on the basis of continuity of posterior interventricular branch from right or left, the cardiac dominance is determined. Right dominance in 60%, left dominance in 10 to 20% and balanced type 20 to 30%. As we told, the left dominance is good, the right dominance is good, and the left dominance is going to affect the persons if the artery is blocked, and the balanced type will be the fortunate persons. So, summary, we finish the right coronary artery. Right coronary artery supplies whole of right atrium and most of right ventricle except the strip along the anterior interventricular artery, as you are seeing in this picture, and the posterior inferior 1/3 of the ventricular septum and SA node and AV node. So, now we will start with the left coronary artery. Left coronary artery, as we saw in the introduction, it is wider than right coronary artery in 70% and it supplies the large volume of myocardium. If you see the origin of left coronary artery, it arises from the posterior aortic sinus of ascending aorta, and same like the right sinus, it will be called as left coronary sinus by the clinicians. In this origin, sometimes the variations may be there. This ostium may be below the margin of the cusps in 15%. This ostium may be double, giving the major branches. Course of left coronary artery taking origin from the left to posterior sinus. So, you have to understand in this picture, if it takes origin from left posterior sinus, it will pass behind the pulmonary trunk. So, you see in this how it passes behind the pulmonary trunk, the dotted lines represent the course behind the pulmonary trunk and appears between the pulmonary trunk and the left auricle. That is how